Good day. It's certainly a pleasure to be back with you on the Healthbeat Show. I'm Dr. Jeffrey Watson, and welcome to the Healthbeat Show.
You don't have to take my word, but I heard if you have your health, you have everything. Take my word, but I heard about the Healthbeat you're gonna be. How do you wanna be? Show me how you will be. How do you wanna be? Show me how you will be.
I'm Dr. Jeffrey Watson. We're right back here on the Healthbeat Show with none other than Dr. Michael Hebrod. Dr. Michael Hebrod has a program in Oakland. Tell us the name of your clinic.
Okay, it's Advanced Physical Medicine and Rehabilitation Group.
Okay, and in that group you actually have, you're a physiatrist.
Physical medicine rehab.
Physical medicine rehab. You have some foot, you have a foot doctor.
Podiatrist.
A podiatrist.
A podiatrist.
A physiatrist, and that's a foot doctor.
And that's a foot doctor.
And you do have a psychiatrist.
We have two psychiatrists.
You have two psychiatrists.
Yes.
And what other providers you have?
We actually have an orthopedic surgeon, two of them who come in and help out. One of the orthopedic surgeons that we have does what we call extremity work. He'll deal with anything from the shoulder on down to the fingertips, and from the hip on down to the toes. Then we have another orthopedic surgeon who comes in and does everything from the cervical spine, which is the neck, down to the tailbone.
Mm-hmm. Okay. So you have a very comprehensive program.
Yes, we do.
That really deals with everything, like I like to say, from your nose to your toes.
Yes.
And that's great. That's great. So what types of patients? I mean, we're talking about a patient that's had a stroke. Mm-hmm. We're talking about patients that have had neurologic disorders. Mm-hmm. You also deal with work-related injuries.
Yes.
And tell us a little bit about that. I mean, I guess that's the place that maybe the psychiatrist may be involved.
Well, oftentimes, yes. When a person is injured on their job, say, such as a mail carrier who does a lot of walking around the streets along the hard concrete surfaces, up and down stairs, twisting, bending, reaching, pushing, pulling, doing this several hours throughout the day, 5 days a week, something is going to wear down. It usually starts at the feet, which goes to the knees, then the hip and the back. And if they're doing a lot of reaching, casing mail and reaching into mailboxes, the shoulders usually kind of start going out on them. So they come in with a series of problems from their shoulders down to their toes. And what we do, we'll bring them in, we'll do the history intake, we'll find out what they do, how often they do it, how long have they been doing it, and then connect that to the type of symptoms that they're having to make sure that we understand that it is actually work-related, or they just didn't stub their toe in the parking lot or slip in a grocery store. We have to make sure that we identify their history as being consistent with the work injury. From there, then we take the next step in providing them what we think is appropriate treatment for them through the proper diagnostic workup. So if there's a problem with the shoulder and they feel it clicking, they can't reach, and they have weakness, then we'll maybe set up on a series of x-rays or MRIs to find out if there's a torn tendon or a muscle in the shoulder. And then from there, if therapy is not effective once we prescribe it, and plus with home exercise program and appropriate medication to help calm the symptoms down, then we will refer them to the surgeon if all that fails over a several-week period of time. So we like to make sure that we give them what we consider to be a comprehensive evaluation with the options to maximize their improvement, and to reduce the risk for re-injury. What that means is sometimes we'll have to give them restrictions. If they have a problem with the shoulder, we may say to them, hey, we don't want you to do any work above the level of your head or at the level of your shoulder with repetitive reaching. No lifting greater than 5 or 10 pounds based on how they present and what their issues are. Oftentimes when these patients do come to us, they are very depressed because they're in a lot of pain, they don't sleep very well, and they can't function very well on the job. So there's a lot of pressure that builds up. As a result of that, some of them a lot of them actually become depressed. So as a result of these injuries that they have, and if they have enough of them, These people are very, very depressed. And when you hear about going postal, we don't want to get into that. But that's just an example of where injuries can lead to chronic pain, which can lead to depression. So we have a team of other specialists, such as psychiatrists, who help to manage these symptoms, because oftentimes pain and depression go together, and until you actually look at it closely, it's hard to treat.
Now, one thing that we didn't even discuss that you have at your center and that you work directly with is physical therapy.
Absolutely.
The whole
yes.
process of physical therapy.
Right.
Now, you have physical therapists at your office, is
Yes.
that correct?
Yes, we have 2 physical therapists on staff. Actually 3, but one of our physical therapists, she specializes in doing other modalities and treatments for the patients to assess their ability to function on or off the job. The other 2 physical therapists are more hands-on with the daily rehab plan in terms of strengthening up muscles and improving posture and teaching what we call techniques for home exercise program. Part of the rehab process is empowering patients who are injured to be able to understand the significance of their injury, but more importantly, to be able to step out on their own and take care of themselves, empowering them with the knowledge and the skills to be able to rehab themselves. So it's about how do we get them independent in their ability to rehab.
So you actually have equipment there.
We have equipment there, but we also teach them how to go home and do these exercises to be more efficient at it.
Take it with them.
Absolutely.
Yeah. Well, that's great. So now then, one other area that is of great concern is pain.
Right.
Pain. You have to deal with that all the time.
All the
If
time.
somebody's hurt, their back, you talked about back problems. And you also would be a specialist in back problems.
Right.
Not just an orthopedic surgeon, but many times I tell patients, they come in and they say, oh God, back's hurting me, we send me to an orthopod. And I will tell them, I'm not so sure that you actually want to have surgery on your back right now. Because do the studies show that back surgery actually exceeds conservative therapy like physical therapy?
Excellent question. Oftentimes, we have patients who have back pain. Back pain is probably one of the most common complaints besides stomach pain that people will probably visit your office with. There are so many different variables or causes to back pain is that it's hard to put a hand on them. But most back pain, let me say 9 out of 10 back pain, or 9 out of 10 people with back pain will probably resolve or get better within 2 or 3 weeks and no more than 2 months. Okay. But it's that 10%, if you will, of people with back pain who go on beyond 2 and 3 months, and when they get into what we call a chronic condition. And these chronic back pains are more difficult to treat because stress and other problems can make them worse. But when they start having problems shooting into their leg, weakness in their leg or numbness in their leg or difficulty going to the bathroom, then that raises another red flag. These people become much more appropriate for surgical intervention, surgery. Because when you start losing power in your legs or weakness or numbness or difficulty going to the bathroom, then these individuals are much more suited for surgery.
They've got pinched nerves.
Absolutely. We call it the sciatic nerve. Now, the other part to that, we do have people who don't present necessarily like that and get a surgery, and studies have shown those individuals who have surgery just for back pain and those individuals who treat conservatively without surgery who have back pain, at 1 year, they're in the same position. The case with surgery up front, they feel better initially, but 1 year afterwards, the surgery is over with, they're at the same place with the people who didn't have the surgery. So the recommendation is what?
Non-surgical.
If you can hold out.
If you can hold out.
Right.
Yeah. Okay. And now, some of the medications that might be used, there's a variety of medications. We've talked with some about the medications used for pain, but there's a variety of pain. Some of the pain, as you described, shooting pain may be neurologic.
Right.
Other pain may be blunt, just in one pace.
Yes.
Other pain may be spasm
Right.
pain. How do you have to be a pharmacologist on top of being a surgeon and top of knowing these modalities.
Right.
How do you deal with these different kinds of pain and decide what a particular person needs or combination of things that they need?
Excellent question again. What ends up happening oftentimes, patients will actually tell you what type of pain they're having if you ask the right questions. Usually a pain that is dull, achy, is usually one coming from the muscle or the bone. If the pain is electrical shooting, it's more of a nerve type of a pain. If it's pins and needles, another nerve type of pain, and sometimes muscular spasms can do that. A tightness or a pulling sensation is a muscle spasm type pain when the muscle tightens up on them and it restricts your movement. Now, the medications that we use oftentimes will overlap, because some of the medications, such as ibuprofen or Motrin, which is what we call an anti-inflammatory, is very good to treat inflammation. Okay, as well as swelling. Nerves do swell. Nerves get inflamed, just like muscles and joints do. They get inflamed. So you can use a medication like that to treat both muscle and nerve pain. Okay, but we have other medications that are more specific to nerve pain that we use, like the gabapentins, now the Lyrica. These medications that are much more suited directly for the nerve pain, but now they have indications for muscle pain as well. The Lyrica with the fibromyalgia. So there's a lot of overlap, but sometimes it's based on the patient's tolerance. It's based on sometimes the patient's pre-existing conditions. People who have stomach ulcers, people who have high blood pressure or kidney problems, I wouldn't necessarily put them on a non-steroidal anti-inflammatory such as Motrin and Advil as a first line, because that can be very dangerous for them.
Okay, we're speaking with Dr. Michael Hebrod. Dr. Michael Hebrod is a physiatrist. He's a specialist that deals with injuries, musculoskeletal, neurologic, pre-existing disorders that you may be born with, and some of them may be non-surgical, some of them may be surgical. Stay tuned, we'll be right back.
Have a good night and rest easy.
Are you tired, sleepy, depressed, snore a lot, sleep a lot during the daytime? Do you have high blood pressure, diabetes, or suffer from sexual dysfunction? You may be suffering from sleep apnea. Talk to your doctor and contact the James A. Watson Wellness Center Sleep Clinic. Remember, we want you to have a good night and rest easy. Give us a call today at 510-444-8627. Remember, that's 510-444-8627, and you'll rest easy.
And we are very fortunate to be here with none other than Chef Leslie. Chef Leslie gets out in the community, teaches people how to make juice, how to cook appropriately, how to keep the fat and fried stuff out, and if you do use any kind of cooking, how to keep it with a low cholesterol, keep the sodium down. And we're even talking some about sugar. How you doing, Chef Leslie?
I'm doing fine.
It's good to see you again. It's good to see you. All right, all right. And it's an absolute blessing to be here with you again, as we've had at so many of these events.
Right.
And you're teaching people about juicing. Now, is there anything special about juicing? What's the benefit of that, or just pouring a carton of orange juice?
Okay, first of all, I think that juicing, we're talking about nutrients, and so we're talking about minimizing the loss of nutrients. And I think that I feel that when you juice, you get all of the nutrients in apples and carrots and celeries and things of that nature. On the other hand, when you do fruit juices, coupled with man-made ingredients, additives and preservatives and corn syrup and fructose, I think it's defeating the whole purpose. It's just been my opinion that additives and preservatives are not good for us.
Now, for instance, you have put into this juice, you have put celery, I saw you put some apples, and I saw you put some carrots in it. Now, may I taste that?
Absolutely.
It just made my mouth water watching you make it. But the benefit of this is with your celery, you've got fiber. With your, apples, you have some fiber. Your carrots, you've got the vitamin A in it.
Yes.
So you've got all these Now, how would those things taste mixed? I'm going to see.
Drum roll time.
Really good.
Yes,
That is
it.
really good.
Oh yeah.
It's kind of like a different flavor, though. I mean,
Yeah.
you got that celery taste mixed with apple and mixed with. I would have never have thought that kind of mixture would just come together. And you didn't do anything special. How many carrots to apples to celery sticks?
for me, I use 4 to 3. 4 apples, 3 celery, 3 carrots, pardon me, and 1 celery.
The carrots are good for your eyes.
Absolutely.
Red and A.
Yeah.
You've got the celery has a lot of fiber in it, which is going to help your colon and prevent colon cancer. Your apples, those are going to have vitamins and fiber in it too.
Absolutely.
A little bit of sugar in the apples, a little bit of natural fructose, and anybody who's a diabetic, you could dilute that with a little bit of water,
Exactly.
so it wouldn't bring their sugar up.
And I think it's really important that juices be talked about in terms of how sweet it is, because not even as a diabetic, sugar also causes obesity.
Right.
And so even my kids, my 3-year-old and my 11-year-old, they still dilute their juice with water, and because that's really important. I mean,
And you've got to clean your fruits and vegetables. Don't just assume.
Exactly.
Don't assume that they're clean, because they can have pesticides if they're on the outside.
Yes,
so that's the
absolutely.
first thing you want to do before you juice. All right, we're right here with Chef Leslie on Down Home Healthy Cooking with the Healthbeat Show. Can I have some more of that? This is really, really good. I'm telling you, because your health is your wealth.
You know it.
And when you have your health, you have everything. I'm Dr. Jeffrey Watson. We're right here at 24-Hour Fitness. We are here with Coach Keith and with none other than the lovely Miss Shamir Washington. And today we're going to learn about how to get that, how do you call it, Shamir? The bootay. We're going to get the bootay strong today. So call everybody in, tell them to get ready. Coach, tell us how to do it.
Awesome. Well, we've hit on the abs. It's time for us to get some balance going. Go ahead and roll over on your stomach, guys. Good. Whenever you work your abs, you always want to also work your lower back. So put your hands down by your sides, palms facing up. Relax your face on the mat. Take a deep breath in, exhale and relax. And you want to gently lift your shoulders off the ground. Do not jerk. Exactly. 1. Perfect.
That's good. I can feel that in the
2.
lower back.
Perfect. 3. Good. 4. If you feel any discomfort in doing this exercise, stop. Good.
All right, you
5.
can do this at home.
Yes, you can. 6. Nice and strong. 7. Remember to breathe. 8.
There you go.
9. And 10.
All right.
Good. Go ahead and roll over. We're gonna fire up those
gluteals. The bootay.
The bootay.
Yeah.
All right. Good.
Get my
good.
bootay strong.
Good. This is for the trophy here, guys. Go
All
ahead
right.
and lift those hips off the ground. Nice and strong. Take a deep breath in first. Exhale and relax. A little bit higher. A little bit higher. Get it up. Get it up. Perfect. And pelvic tilt. 1, 2, higher. 3, higher. 4. Nice and strong. 5.
Oh, I see what you're talking about.
6. Good. 7, 8, 9, 10. Hold it up.
Okay.
Deep breath in.
Oh,
exhale,
I can
and relax.
feel it in the
Open and close
bootay.
Inner thighs. A little higher, Shamir. 1, 2, 3, 4, 5, 6. Come on, nice and strong. 8, 9, 10. Excellent, Doc. Keep it up. We're going to combine it all together.
Okay.
Pelvic tilt and open and close. And go. 1. Good. 2.
Oh, yeah.
3. Perfect. 4.
That's
Nice.
good for the
5.
behind.
Good.
Oh,
6.
it's burning.
7.
It's
Good.
burning.
8, 9, and 10. And relax your hips.
Oh.
Deep breath in. Exhale and go ahead and roll over on your stomach.
That's a good gluteal exercise
We're not
coming
done.
from the
We're
coach.
not done. We're not done. We're gonna fire. We're gonna keep them on fire.
Okay.
We're gonna tone and shape those glutes nice. Relax your face on your hands. Bring your legs into a 90-degree angle. Heels together, toes turned out. You're gonna relax your upper body. Take a deep breath in. Squeeze the glutes and lift your knees off the ground. Perfect. 1,
Oh, that's
2. Good. Lift. 3. Good job. 4. 5, 6, good. Finish strong. 7, 1, come on. 8, that's it. 9, and 10, and relax.
All right. All right, well, there you have it from the coach. We've learned some about how to get those glutes going, that behind, that bootay. We've been talking about sit-ups, about the core of the abdomen. You can do this at home. We've enjoyed it right here on Fitness Facts. Stay tuned for the Healthbeat Show. I'm Dr. Jeffrey Watson here with Miss Shamir and with the coach. I'm Dr. Jeffrey Watson with the Healthbeat News. As we enter the new year, remember the 8 healthy guidelines of living. Number 1 is prayer and meditation. Number 2 is to read and gain knowledge. Number 3 would be to eat to live, don't just live to eat. Number 4 would be to exercise regularly. Number 5 would be to rid yourself of addictions, cocaine, alcohol, smoking. Be a good time to stop. Number 6, get enough rest and relaxation. 8 hours of sleep, just like Mom said. Number 7 would be to commune with nature. Go outside for a walk, get with the sunshine, get around plants. And number 8 would be to get your regular checkups. That would be to get your blood pressure checked, your sugar checked, a hemoglobin A1C, a mammogram, a colon exam, a prostate evaluation, a heart test. Be tested for HIV, be tested for hepatitis, your cholesterol checked. The 8 healthy guidelines of living. That's what it's all about. If you knew better, you could do better. I'm Dr. Jeffrey Watson. Remember always that your health is your wealth. And we're back. I'm Dr. Jeffrey Watson right here with Dr. Michael Hebrod. Dr. Hebrod is a physiatrist. And we're talking about everything from your nose to your toes. Now, one of the things that you mentioned that physiatrists do is they work on sports injuries.
Yes.
And I do want to just take a brief aside. Dr. Hebrod knows a lot about this, not only because of injuries that he received during sports activities, but he has taken his time out to actually start a football team in Berkeley, known as the Berkeley Bears.
Yeah, the Berkeley Junior Bears.
The Berkeley Junior Bears.
Right.
And they go from what ages?
They go from the ages of 5 to 15 years old. We just added a new team this year. We have a total of 6 teams. And we want to make sure that we provide these children an opportunity to get out there and to play in a safe environment. But we also have cheer as well. So they're also ages from 5 to 15 years old.
So the girls are involved.
The girls are cheering.
It's a family affair.
It's a family affair.
And I can't tell you how proud I am of you for the work that you do in the community. I'm talking about hundreds of people, if not thousands, are involved with this project that you have put yourself out there and taken upon yourself to do. And I guess that's because you know of the benefits of sports and exercise and physical activity as it relates to the overall well-being of an individual. But you have a person that maybe gets hurt on the field.
Yes.
And they come in. How does a physiatrist help them to heal, help them to be able to go back to playing sports?
Okay. Well, one of the major things that we like to do in any field of medicine is prevention. Okay, and prevention is a key thing because you want to educate people about how to do things appropriately and properly. So that's usually through fitness. You want to condition their bodies, so when we get the young kids out, just like the professional athletes, we want to get them in shape so they can participate in the activities with the less risk of injury. So that's the first thing, and we want to prevent the injury. But oftentimes, we are successful in doing that, but the few times that injuries do happen, we have to be able to deal with them. Say if a guy injures or a girl injures her knee and they twist her knee and they sprain the ligament there. Well, sometimes we'll put the knee in the brace to help protect the knee while it's going through the recovery phase, reducing the swelling and the pain, and sometimes medication may be appropriate. The other step to the recovery phase is the conditioning, reconditioning, if you will, the strengthening of the muscles that support the knee in order to keep the knee from shifting and moving in improper ways. So there's a gradual step going back to those regular activities, but we try to take our time in doing so by reassessing the patient to make sure that they're pain-free before they can actually participate fully in that activity, and we watch them as time goes on with very specific exercises and evaluations.
And then you follow them probably through their return to the sports activities.
And then periodically after that to make sure whatever exercises that we've shown them to keep up with, that they're actually doing them and they're doing them appropriately.
And you may, when I watch basketball, you watch the All-Star game,
Right.
and you watch football and all this stuff. Now you're seeing, I mean, clearly underneath the uniforms or right there on them, knee braces.
Yes.
And you put other types of modalities. You were talking about things in the shoes, maybe.
Right. Sometimes sometimes we'll use orthotics. Orthotics is what we actually insert into the shoe, and when we find that some of our athletes, or even just the regular everyday people, have what we call flat feet. Mm-hmm. And when their feet are flat, it puts a lot of stress on their ankles, their knees, their hip, and the back. So by inserting an orthotic into the shoe, it allows the arch, if you will, to be better supported, which takes stress not only off the foot, but also the knees, the hip, and the back. So when they're walking, they can walk much more efficiently with less pain.
All right. We're talking with Dr. Michael Hebrod. He has a practice in Oakland, Advanced Physical Medicine and Rehab group, and they have a pretty much a group, as you've just said. You have orthopedists, you have psychiatrists, you have the physiatrist, you have the podiatrist, the foot doctor.
The foot doctor, yes.
Now, can a patient call you directly and ask to be seen, or do they have to be sent through their job, or how could one come to see you?
Well, for the work-related injuries, it's usually has to come by way of contacting their adjuster. Usually, if a patient's been injured on a job, there's a process by which they have to go to Human Resources and fill out, an accident. And once the claim is accepted, they can have the opportunity to look for a primary treating physician. But the way most of the workers' comp situation is set up, they have to spend 30 days in one of the local ACME clinics, such as Concentra or United States Health Works, and then after that time they can choose their own treating physician. If it's a private insurance, where like Blue Cross Blue Shield or even Medicare, sometimes a direct referral from their physician for a specific problem can be handled. So
okay,
we'll take
and
referrals.
how would one get in touch with your office if they wanted to come see you?
Usually by phone. We do have a website, but the phone is usually the quickest way to kind of get a hold of it. We're still antiquated.
And what would that number be,
That
Dr.
number would
Hebrod?
be area code 510-465-1108.
465-1108.
Yes.
Okay, we're talking with Dr. Michael Hebrod, physiatrist supreme, and he will help you to be a better human being. All right, so if you have any further questions about neurologic problems, musculoskeletal problems, sports injuries, work injuries, pain, all these types of things, Dr. Hebrod is our resident specialist on all of those types of things. We thank you so much for being with us.
Thank you so much.
Okay.
Alrighty.
God bless you, man.
Thank you.
Keep it going with the kids, too.
Oh, and thank you for your support with the kids.
Okay.
All right.
All right. Well, I'm Dr. Jeffrey Watson. This has been this week's Healthbeat show. Remember always that your health is your wealth, and when you have your health, you have everything. God bless.
How it will be.